So I picked this particular case study when I picked it because it dealt with a protozoa, right? And this isn't something we commonly think about causing infections, right? Whenever we talk about infections, we immediately usually think of bacteria and things like viruses, and we kind of forget about protozoa and the next one that we're going to talk about, which are fungi, because these tend to be a little bit rarer type situations, mostly because we don't have as much contact with them as we do with other pathogens. So for this particular case study, right, several members of a family show up at the doctor's office without an appointment. They've got severe smelly diarrhea, gas, abdominal cramping, which began Friday evening. Since these general symptoms are associated, right, the doctor's like, well, that could be any number of things, including, of course, viruses are the ones that usually will cause major disturbances to our digestive tract. So he's not overly concerned. He sends his patients home with Imodium to stop the diarrhea. Of course, with diarrhea, you have excessive fluid loss, so we want to make sure that you drink lots of fluids. And when you have disruption to the intestinal tract, you'll sometimes have disruption to the normal flora in the intestines, and this can create other problems. So, you know, yogurt is a good probiotic, and nowadays, of course, they push that out the wazoo, right? You've got all the commercials now for Activia and stuff like that. And all they've done is, you know, put specific microbes in it that, you know, scientists have run tests on and that they believe lead to the best beneficial environment. But truth is, right, yogurt's always been a good probiotic because of the microbe cultures in it are ones that are beneficial. So one of them, the little one, who's 18 months, had a poopy diaper, so the doctor's, oh, great, you know, I'll just take a sample, right, send it off to the lab and see what we get, instead of having one of the adults give a sample. The little one kind of helped them out. So the next day, he's surprised by 6 other patients, right? So he's like, oh no, this is not good. A few of these patients also complained of nausea, headache, and a mild fever. By Thursday morning, he was truly concerned. 18 patients in 4 days had presented with the same symptoms. He had admitted one to the hospital, and this particular individual, Jake, had been diagnosed with HIV. So we know he's more susceptible to infection, right, because he has this virus that specifically targets his immune system. So since he wasn't especially compliant with his prescribed antiviral therapy, so this puts him at an even greater risk, right, because the virus is debilitating his immune system, leaves him more susceptible. So he was suffering from several opportunistic infections associated with this compromised immune system. Dr. Jenkins arrived at his practice. Jake was extremely dehydrated. He'd lost 7 pounds in the past 7 days due to the severe diarrhea. So here's somebody who is going to be even more impacted by an infection, right, of this magnitude. So thanks to Maria and her stool sample, right, and her little diaper, he got back from the lab that it's Giardia. So this is not common, right? This is a protozoal infection, and chances are there's a common source where all the people got this infection. So before we move on to where, what, and how, and why, right, let's talk about the organism itself. So under the microscope, they probably saw the cysts, and they're pretty characteristic cysts that will form and be expelled into the feces. As well as the trophocytes, it's the cysts that are actually create a problem, because those can go into the environment and they can be picked up by others. And when they travel through your digestive tract, they come out of that cyst, out of that resting phase, and become the trophocyte, which is the feeding phase. And what you see here for this picture is that the endothelial lining of the intestines, these organisms have suction cups like, and they literally attach and suck off the mucus and eat it from your intestines. And so what you see here, these marks are where ones were, right? That's the impression from the sucker. And this is probably 2 organisms still attached. So good old Anthony von Leeuwenhoek, remember him? Our little inquisitive man looking and creating his own lenses and looking at stuff. So what do you think he looked at to actually see? And yeah, he looked at his own poop. He was a really curious individual. And so some people can have this infection and be asymptomatic, actually not have any serious problems from it. Right? So you could have Giardia in your intestines right now and not actually causing a serious problem for you. Which was probably the case for him. Right? He probably wasn't necessarily sick, and that's why he decided to look at his poop. But it could have been the case that he was sick. So these are single-celled organisms known as protozoa. They have 2 paired nuclei, which is why when we look at the picture of them in a moment, they almost look like they have eyes. They're not. It's just the nucleus splits into 2. And they have multiple flagella that come in pairs of 4 for a total of 8. So that's how they can swim through the digestive tract and in aqueous environments. As I mentioned, they have that sucker disc that allows them to suck and attach to the intestinal lining. And that trophocyte is the feeding active phase, where the inactive form is the cyst. And so it basically encases itself, just like how bacteria encase their DNA in endospores. Cysts, they encase the whole organism. And actually, when these guys bust out, it'll be, I forget how many will bust out. 2 of them. So see how they kind of look like they're squished up in there? 2 of them will actually bust out of a cyst. So these are different drawings, and nowadays they even make cute little stuffed animals for nerds like me, which I actually don't have one of these, but they have, you know, the good old Giardia stuffed animal. That's what this is. But these are, you know, different pictures and drawings, and as you can see, the paired nuclei, as I said, almost look like eyes. This is an interesting one where you can see the bottom side and see that sucker that they use to attach to the surface. Interesting looking organisms for sure. So where is this microbe commonly found, and how is it transmitted to humans? So it's in the intestines of humans and animals, and as I said, you could have it and not even know it. The cysts are shed in our feces. So typically what happens is that you have fecal contaminated water, and again, it's the cysts that are in the water. Someone ingests the contaminated water, or ingesting food that has been contaminated by contact with the contaminated water. This is commonly referred to as a fecal oral route, right, where something from the feces ends up in our mouth and into our intestines. So what's the infectious dose? Well, first of all, what is infectious dose? It is the amount of pathogen measured in the number of microorganisms required to cause an infection in the host. So the bad news with this, because those cysts are kind of protected, they can pass right through, and even the acid of our stomach, helps them come out of their cyst phase, so that they are then the trophocyte, the feeding phase in the small intestines, that can attach to the epithelial layer. So it doesn't take a lot, 10, right? We're talking about microscopic things. So, I mean, you're not going to see them, are you? The incubation period, so this is a time from ingestion, when you ingest it, to when you typically will have symptoms of it, is about a week. But as you can probably see with this case study, it can be much quicker. So what are the symptoms associated? We've already seen most of these as they presented to the doctor. So do they always have symptoms, and how long is the duration of the symptoms? And asymptomatic means that you're not experiencing any symptoms. And so up to 50% of people with Giardia are not experiencing symptoms, any of these symptoms on this list. Some symptoms that they can experience are diarrhea, right? And the problem with this is it can be severe if it leads to dehydration. Gas, greasy stools that tend to float. Found that one interesting. Abdominal cramps, again, right? Something is happening in your intestines. Nausea or vomiting, again, related to the effects of the digestive tract. Why do you think you would maybe experience headache, especially if you're having some of these other symptoms? Dehydration. Most of the time when you have a headache, you're dehydrated. Drink some water, right? Yeah, well, again, that's an intestinal infection, right? So, you know, these are things where there's something going on with your intestines, right? You've got diarrhea, you've got gas, you've got abdominal cramping. Fever, again, this is sometimes a normal response for your immune system, right, is to have fever, to try kill off the pathogen. Now, chronic infection, this is long-term, right? So someone could have it for a long period of time, can lead to weight loss due to malabsorption. So this is where you've got the infection, right? It's lining your small intestines. What happens in your small intestines? Absorption of food. So if they're taking up that space and even eating some of those nutrients, you're not going to have as much absorption. And so therefore you're going to lose weight. Now, this is no reason to potentially try and get this infection, right? There are crazy people out there that purposely ingest what sometimes? Tapeworms, parasites. Not a good idea, right? Not a good idea. We live in the internet age and shipping. Enough said. The crazy things that crazy people do. Or uneducated, right? And don't know any better. Don't purposely infect yourself. So, what symptoms are associated with this disorder? What is the duration of the illness and are infected individuals? So this is just continuing on that. So acute, right, is typically 1 to 2 weeks, but can be longer. Why? Well, no, if you have acute illness, right, it's fast onset, right, you know this is going on, but you may not necessarily get treatment, right? So this could persist. Or your immune system might not be able to eliminate them. And therefore, without treatment, it's going to keep going. Chronic illness is usually milder and slower, right? So the symptoms aren't as severe. They'll go on for a longer period of time. So we're talking months or years with relapses and remission periods. So again, the immune system doesn't really take care of it well enough. You don't realize what's going on. You don't seek treatment, right? It just keeps going and going. Asymptomatic, right? They never feel sick. So therefore have no reason at all to ever seek treatment, right? They're the carriers. They're responsible for the spread of infection when it comes to the human population. Wild animals don't willingly walk into the veterinary office. So remember, they're going to be another source of infection other than humans in some cases. Make sense? Okay. So who's at greatest risk for infection? Well, of course, immunocompromised, as we saw for our individual with the HIV, or people who have chronically ill. The very young, infants and children, are going to be the most susceptible. People in daycare settings, and again, the problem there, we worry about the spread, to the very young. Those who come in close proximity with someone who is already infected, travelers to countries where Giardia is common. Someone who drinks contaminated or untreated water, right? So you're going to leave yourself susceptible to these types of infections. If you're camping, hiking, swimming, shallow wells that can be contaminated. People who have unprotected anal sex, because again, you're coming in contact with fecal matter. People who have contact with infected animals. This risk is small because the type of Giardia that infects humans is often different from the type that infects humans. Although I haven't seen any definitive evidence on that. How is it diagnosed? Well, because these cysts can be excreted sporadically, right? And, you know, they really got lucky with the good old poop in the diaper. It can often sometimes be really hard to diagnose. So they'd have to do multiple stool samples, right, to try and rule out this type of infection. But nowadays, thanks to different types of testing that are a little bit more sensitive, instead of just having to, you know, look under the microscope, and can you imagine when they do stool samples and stuff for, you know, your dogs and stuff like that when you bring them to the vet, they put in a special solution, and those cysts and things like that and different components of the worms will float up to the surface, and then they put a slide on it and it attaches to the slide. So they do similar type things when they do stool samples from humans and stuff like that. But again, the chances of actually getting one on a slide and actually seeing it on the microscope are actually pretty slim. So other types of testing, immunological assays, where we're actually using antibodies to detect for the presence of these really small molecules, are much better diagnostic tools of actually getting a positive sample. So a direct ELISA, which stands for enzyme-linked immunosorbent assay, or sometimes just EIA for short, which is enzyme immunosorbent assay, we can detect for the presence of this antigen, of this pathogen specifically. And these tests, as I said, use antibodies to detect for the presence. So much more sensitive, very specific for Giardia. In order to identify subtypes, so remember the type that infects humans, they believe, isn't the type that necessarily is commonly found in animals. They'd have to do further molecular testing. So they're literally looking at DNA differences between the different organisms. It's crazy what we have the ability to do nowadays. So how is this infection treated? Flagl is the trademark name. The chemical name is Metronidazole. I hope I'm saying that one right. This treats several types of bacteria and parasitic infections. So this one kind of falls under parasitic infection. It is an antibiotic, which means it's produced by a microorganism to kill or inhibit other microorganisms. I don't know what organism actually produces it. It works to fight infections by entering the bacteria or parasitic cells and producing free radicals. So these are molecules that are highly charged and damage the cells. And the bacteria they typically use this with, I think, are anaerobic bacteria. And again, it really keys in on their energy-making abilities and interferes with that process, creates these damaging molecules that destroy the cells from within. So Dr. Jenkins contacts the county health department. Of course, he's got so many significant cases, right, all with similar symptoms, and he's got a confirmed lab report now of Giardia. So, you know, he needs to find out what was this point of source, where did everybody come in contact with this. So with their help, stool samples were collected from all of his affected patients, and other local physicians were notified. Workers from the health department were soon able to establish an epidemiological link between the patients. So in other words, where did this come from, right? What's the link? So 10 days earlier, everyone had celebrated the town's centennial. which included a strawberry festival featuring shortcakes made with locally grown berries of the Taylor family's farms. After a visit to the farms, it was determined that the berries were irrigated using ditch water. We all know about this, right? There's plenty of ditches in Louisiana. Sampling water from the various ditches in the vicinity of the fields yielded approximately half of the specimens positive for the cysts of the suspected pathogen. The sale of produce, of course, from the farm was suspended, and the proprietors were ordered to use an appropriate water source for irrigation, right? A cleaner water source. So how did the microbe get from the irrigation water supply? How did it get into the irrigation water supply? Could have been animals, could have been humans, right? It could have been that ditch contaminated with sewage somehow, right, from the area. So it's usually found in water polluted with fecal or manure contaminants. Activity of wild animals, livestock near a water source is the most common mode of transmission. Okay, and that's why it's not a good source of water to be used on food crops. So this is from the CDC's website, and again showing the life cycle. Most commonly, right, we're going to ingest the cysts. Those are going to come out of the cyst phase, yield the trophocytes, which actually attach in the small intestine by those sucking discs. And the trophocytes and the cysts are shed in our feces, but these guys, if they're not in the suitable environment, they'll die. But the cysts are a resting stage, and that's typically what you're picking up when you're adjusting stuff that's been contaminated with these cysts. So, and this is just an outline of that in word form of what I just talked about. So, according to the data from the 2010 MWR report, and this is a weekly report, it's a mortality and morbidity weekly report put out by the CDC on their website each week. And so I looked at one of their summary reports, and I specifically looked at, when you looked at it, you saw in the months of July, August, and September, and October, right, there was a significant increase in the numbers. Why do you think that this particular time of the year you'd probably see more of an increase? What are some of the places where you said you can get this infection from? Say again? Where it snows? July, August, September, and October? When crops are being harvested? Okay. Swimming, hiking, more outdoor type activities, especially, you know, I guess I didn't have my report there. Here, let me switch over to it. Look at the actual numbers. I don't know why I didn't put that in my PowerPoint. So as you can see, there really isn't any real pattern to the incidence, right? The number of cases occurring per 100,000 in the population. It's kind of sporadic. There's no really set pattern. And as it says, widespread geographically. But when you look at, right, these numbers of reported confirmed cases, right, you really see that spike in that time frame. And I would really probably contribute that to more exposure to natural waters, whether swimming, hiking, camping, even like you said, food being harvested during that time, eating fresh fruits and vegetables and such as that. So what agricultural practices should be employed to prevent contamination of crops? Well, obviously irrigate with groundwater other than potentially contaminated surface water. Drip irrigation is preferred to sprinkler or overhead irrigation as it reduces the contact between the fruit and the water, right? So we're not spraying it on top, right, and getting that spatter, but dripping it down at the base of the plant. Less chance of splashing and the contamination onto the fruit. Maximize the interval between irrigation and harvest to lower contamination risk, right? Don't spray them and then pick them right away. If the surface water is used for irrigation, restrict access, right, so that livestock and wild animals cannot use it as a toilet. Consider testing and treating, right, chemically disinfecting slow sand filtration as an effective way of removing these types of contaminants from water supplies. Manure and other organic fertilizers should be fully composted before field application and should not be used in the year of the berry harvest. So they shouldn't use, right, manure and stuff that may contain these organisms and risk the exposure to the fruit. Emphasize good hygiene in all workers contacting the fruit, right? Because it could have come from, you know, the actual people handling the fruit. And it's another way in which infection could occur. Infected or ill employees should also, of course, not be permitted to assist with harvest. So how is it transmitted? How can you prevent transmission? So poor hygiene with feces, right, is obviously how it can be transmitted. How do we fix that? Use proper hygiene. Contaminated water, don't use it. Use clean water. Food contamination, prevent it from happening, right? And how is food contaminated? It could be any number of ways, right? In that case, it was contaminated by irrigation. Could get contaminated by people handling the food, people processing the food, right? The preparers, right? There's lots of steps, unfortunately, in the process of our food that can lead to contamination, right? That we always have to be aware of and try to prevent as best we can. All right, so